Good day everyone. Today we're going to learn about Human Immunodeficiency Virus or HIV for brevity. And let's start our discussion. For starters, what is HIV? Well, Human Immunodeficiency Virus or HIV is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and disease. Basically, it targets the immune system and weakens people's defense against many infections and some types of cancer that people with healthy immune system can fight off. And as the virus destroys and impairs the functions of immune cells, infected individuals gradually become immunodeficient. But have you ever wondered, is AIDS and HIV similar, or do they have any differences at all? Or although the terms HIV and AIDS are so closely associated that many people mistakenly consider them synonymous, HIV and AIDS are very different. Even though HIV and AIDS are well known, many people are unsure of these differences between them. First, HIV infects humans and weakens the immune system, compromising the body's ability to fight off bacteria, viruses, and other agents that cause disease. So from its very name, it describes virus and only humans can contract it. And it basically attacks the immune system, and as a result, the immune system is unable to work as effectively as it should. Now, looking into AIDS, AIDS is a disease that results from HIV, severely compromising a person's immune system. So it can be inferred that while HIV is a virus, AIDS on the other hand is a condition. So a person, let's remember this, a person can have HIV and never develop AIDS, but anyone who's diagnosed with AIDS has HIV. But how do people get, or basically how is HIV transmitted? First, we can get HIV by coming into direct contact with certain body fluids from a person with HIV who has a detectable viral load. And these fluids are blood, semen, rectal fluids, vaginal fluids, and even breast milk. HIV can also spread through specific activities, and these are having vaginal sex with someone who has HIV without using a condom or taking medicines to prevent or treat HIV. We also have sharing injection drug equipment such as needles with someone who has HIV. There are also less common ways to transmit this HIV. So we have here during pregnancy, so from mother to child during birth or even breastfeeding. However, the use of HIV medicines and other strategies in United States have helped lower the risk of mother-to-child transmission of HIV to 1%. Another thing is getting stuck with an HIV-contaminated needle or other sharp object, and this is a risk mainly for healthcare workers, and this risk is very low. HIV also can spread in extremely rare cases by, first we have having oral sex. But in general, the chance that an HIV negative person will get HIV from oral sex with an HIV positive partner is extremely low. Another thing is receiving blood transfusion, blood products, or organ or tissue transplants that are contaminated with HIV. Another thing, being bitten by a person with HIV. Each of the very small number of documented cases has involved severe trauma with extensive tissue damage and the presence of the blood. There is no risk of transmission if the skin is not broken. Another circumstance is if there is a contact between broken skin, wounds, and mucous membranes and HIV-infected blood or blood-contaminated body fluids. Another thing is deep open mouth kissing. If both partners have sores or bleeding gums and blood from the HIV-positive partner gets into the bloodstream of the HIV-negative partner. And let us remember that HIV is not spread through saliva. Another circumstance that will transmit HIV is the fact of eating food that has been pre-chewed by a person with HIV. The contamination here occurs when the infected blood from a caregiver's mouth mix mixes with the food while chewing. And the only
After
common
discussing
cases
how
here are
HIV
among
is being transmitted and its symptoms, we now focus on how do we prevent it. Today, more tools than ever are available to prevent HIV. But let's remember, anyone can get HIV, but we have or we can take steps in order to protect ourselves from it. And this includes first, of course, getting tested for HIV. We need to talk to our partner about HIV testing and get tested before we even have sex. Another thing to remember is we need to choose less risky sexual behavior, since HIV mainly spread by having anal or vaginal sex without condom or without taking medicines to prevent or treat HIV. Having said that, another way to prevent it is using condoms every time we have sex. Another way to prevent it is limiting the number of our sexual partners, because the more partners that we have, the more likely that we are to have a partner with poorly controlled HIV or to have a partner with a sexually transmitted disease or STD for brevity. Both of these factors can increase the risk of HIV, and in relation to this, we need to get tested and treated for STDs. We need to insist to our partners and even to ourselves, convince ourselves to get tested and treated, because having an STD can increase our risk of getting HIV or even spreading it to others. Another way is talking to our healthcare provider about pro-exposure prophylaxis or PrEP for brevity. So PrEP is an HIV prevention option for people who do not have HIV but who are at risk of getting HIV. This involves taking a specific HIV medicine every day to reduce the risk of getting HIV through sex or injection drug use. Another way here, we have do not inject drugs, but if you do, of course, use only sterile drug injection equipment and water, and never share our equipment with others.